the medical assistant, chapter 1, your scope of practice. You will notice on the board over here, I already have scope of practice written up there. That basically is what you can and cannot do as a medical professional, okay? So if you want to write that down, how I would write that down is I would put scope of practice at the top, and then I would leave room to make like a diagram underneath because you're going to add information below, okay? So let's go ahead and go to the next slide. The role of the medical assistant. Medical assistants often do clinical and administrative things. They work in both capacities. So yes, you might be drawing blood one day, and then the next day you're going to be registering patients in the computer system, because that's how medical assistants work. We're a very versatile job. We can do both. We are the little black dress of the medical world, meaning like it's good for day and night. Like it's casual and it's like appropriate, and then it's, you know what I mean? Medical assistants can do so many things, and it's a really awesome job, and I'm so excited to share it with you. So an MA can work inside of a clinic, like an urgent care clinic, or a like an allergy clinic or an oral surgery clinic or something like that. They can work in hospitals. We don't work on the floors though. So don't confuse a medical assistant with an STNA in the sense that they work on floors. We do not do direct patient care in that capacity, okay? So we don't work with like denture care. We don't do hygiene care and stuff like that, okay? Make sense? We also can work in doctor's offices. Obviously, that's probably where you're going to find most medical assistants, but we can even work in surgery, like surgery offices. I used to work for an oral surgeon. We would take teeth out. Like there's all kinds of cool stuff you can do as an MA. The sky is literally the limit. Doctors and certified nurse practitioners are who we work for, okay? So underneath of them is us. So you see a doctor, we have to work under the direct supervision of a physician or a nurse practitioner. That's something that you need to understand. And maybe if you want to write it down, I would, because medical assistants have to work under the supervision of a physician or a nurse practitioner. Okay? We're going to learn a lot more about that when we get into medical law and ethics, but just be aware that they are only legally allowed to work under the direct supervision of a physician or a nurse practitioner. A lot of the duties vary depending on where you work. So if you work in an urgent care, you're probably going to take vital signs. You're probably going to do intake assessments. Well, not necessarily assessments, but you're probably going to do like patient comes in and they tell you that they have an earache. You're going to take them to the back, get their height, weight, pulse, respiration, and temperature and blood pressure, and then you'll room them. And then when the physician comes in, you will probably go in with the physician and assist them with whatever it is that they're doing, and then you'll leave. And that's it. Like, that's your job as an MA in a medical urgent care, okay? Settings, offices, hospitals, specialty offices, and the MA is also a term. The term is called liaison. Sorry, I'm like tripping over my own words today. So the term is liaison, which means you're the go-between. So if the doctor needs something between you and the patient, you're the person in the middle. Okay, so you've got patient here, doctor here, MA here. The doctor's going to tell you what you want, what they need, what you need to do for that patient. I don't know why I can't talk. Like I just got all tongue-tied. Sorry. So they're known as generalists, is what MAs are known as, because we can do clinical and administrative work on both sides. How many of you pre-read? Raise your hands. I'm so proud of you. Thank you for pre-reading. Was it helpful? Do you feel more connected to the content that I'm teaching you? Awesome. So another question. Have you seen the term generalist yet? That's one of your key terms. So you're going to see it soon. Have you seen the term liaison? Is any of that familiar? These are terms that are going to be used to describe medical assistants throughout. So just make sure you kind of stay familiar with those terms. The job outlook for a medical assistant is huge. They are needed every day, all day long. And medical assistants, the projected job growth from by 2022 is 29%. The average job growth prediction is between 9 and 13%. So that's a huge amount. And hospitals and offices are constantly looking for MAs. I know for a fact that Ohio Health and Avita both run through MAs and they need them constantly. So there's always jobs for people that do what I do and what you're learning to do. Okay. So to become a successful medical assistant, this is on your test, by the way. To become a successful medical assistant, you need to acquire a specific knowledge base, which is why you are here, right? You're here to learn how to become a medical assistant. So theory, a system of ideas intended to explain something, that's your knowledge base. Skills, second thing, skills. Procedures, the way you do stuff, okay? And then behaviors, professional characteristics, qualities, and behaviors that demonstrate commitment to effective performance in a given job. Can somebody shout out to me some descriptors of behaviors that are professional? Not on your phone. Good one. Pay attention. Yeah, absolutely. Can you repeat that? Proper clothing, wardrobe. Yep. Being on time. What do we call that? Responsible. Dependable. Proper hygiene, right? Those are terms that we use when somebody is professionally behaved. Honesty, ethical behavior, stuff like that. That's all things that we look for in a medical assistant. If you were to come into my office to interview for a position that I'm hiring for, and I see that you're not wearing the appropriate outfit for an interview, your resume is not correct or not really that great, you might have the most skills and be the best MA in the entire world, but on paper, you just don't meet the needs of what I need to see. Okay. These things are important. Don't get tattoos on your face if you want to work in healthcare. Some places allow you to have tattoos on your face, but very few do. And it's going to be difficult to get a job. I know it's judgmental, but unfortunately that is the way the society is. In healthcare, you have to be professional, appearance-wise and behavior-wise. You must also be professional. You must be patient and kind, on time with reliable skills, excellent communication skills, administrative skills, and clinical skills. So the next year and a half, or the next year and then this year, we are going to be learning all of those skills, okay? That's what this is for. You're going to learn everything that you need to learn to be a successful medical assistant. Are you excited? Yay! Okay, the scope of practice. Medical assistants cannot examine, diagnose, prescribe, or treat. Okay? So, I like to do something where I have you repeat what I've said if it's really, really important. Okay? So, we're going to say it together. Medical assistants cannot treat, prescribe, diagnose, or examine. Who does those things? The doctors. Very good. Okay, so each state has their own laws regarding what MAs are allowed to do and not allowed to do. Sorry, my voice is getting a little froggy. If you click on the link in your presentation, you will see, okay, you will see the list of laws. You'll have to search Ohio, I believe, but you'll be able to find those there. I will come back to that in a little bit and we'll go through it together, okay? So, there are many different types of medical assistants. There is a certified medical assistant, which is what I am. I was certified. I took a very hard test, a very big test that was very expensive, through the American Association of Medical Assistants, the AAMA. They certify CMAs, Certified Medical Assistants. Then there is the RMA, which is through the AMT. Oh, BTW. In healthcare, acronyms are life, so be prepared to write lots of acronyms down and what they mean. So the RMA is a registered medical assistant, same knowledge base, same abilities, just a different company, okay? The AMT is American Medical Technologies, and they certify RMAs. This may or may not also be on your chapter quiz that we will take on Monday. The CCMA, which is what you will get to sit for at the end of senior year, is through the National Health Career Association. Stands for a Certified Clinical Medical Assistant. Okay? That's what you get to sit for. I have taken the test. It is not terrible. You will be successful as long as you put in the effort. And then the AAPC, American Academy of Professional Coders, they certify people to become medical billing and coding specialists, okay? Something that you don't need to do unless you're really into that. So really quick, I'm going to say the 4 acronyms and you're going to say them with me. CMA, RMA, CCMA, AAPC. If I were you, I would pay attention to these, okay? These are important. Not one is better than another, okay? We're all equal. But each one of these companies that has certified you, whether it's the AAMA, the AMT, etc., are accreditation companies. Remember that buzzword I was telling you about when I was introducing you to our key terms? Accreditation companies are the companies that provide you with the licensure opportunity after you've received the education, okay? Physician's licensure. All right, so there's a lot of buzzwords here that you need to pay attention to. Reciprocity. Does anybody know what reciprocity means? Say reciprocity. Reciprocity, that's a weird word, right? I know, you got to get used to these weird words. Reciprocity is where one state recognizes or acknowledges the licensure requirements of another state as being similar to their own. Okay? Revocation. Say revocation. Each state's medical board of examiners or board of medical examiners provides procedures for suspending or revoking licenses. So reciprocity is where one state says, oh, hey, Arkansas's licensure requirements are the same as mine for physicians. Cool. Revocation is where somebody did something they weren't supposed to do in healthcare and their license was taken away. Okay, make sense? Everybody with me? Anybody got questions? Okay. Physicians must continue their education following licensure by completing continual medication. That's it. Taking a nap. Medical education units. Now, once you have certified as a CCMA through this program at the end of your senior year, you also will have to be taking classes of CEUs, continuing education units. That'll be the same expectation for you every 2 years as it is for a physician. Healthcare providers. Medical assistants are agents or representatives of the healthcare provider that includes one who is licensed to examine, diagnose, and prescribe treatment. So, we know that medical assistants cannot diagnose, examine, prescribe, or treat. Very good. But who can do those things? Doctors, also nurse practitioners. So an MD is a doctor of medicine. Okay, that's what, if my name was Kara Hines, MD, it would be Kara Hines, doctor of medicine, okay? DOs are doctors of osteopathic medicine. And that's it. Those are the 2 types of doctors that you will encounter in as a medical assistant. Now, like I said, you will also work for physician's assistants, nurse practitioners, anybody in the area that might be over you in terms of like their job is to tell you what to do. Okay? So let's go back. And if you would like to click on this and follow along, you can. Or if you would like, I'll just click on it myself and we'll go through it together, okay? So this is the American Association of Medical Assistants website. This is where I'm certified through. So these rules are a little bit different probably than what you might see through the NHA website. But we're going to click on Ohio, which I can't find. There it is. And there's rules. You can see here, this whole section is rules. Okay, it's just a lot of stuff you can and cannot do.